Okay, so I'm sitting here with one of our preceptors, our internal medicine preceptor, and her name is Maylee Miller, and she is actually one of our residents that went through the program, so obviously she's amazing. But she is one of our first preceptors that you'll see in the program, so I wanted to ask her a few questions for you. So Maylee, what would you say are your characteristics that you look for in a resident, actually, not a preceptor?
So some of the things that I look for when I look for a resident who is successful within residency is having good time management skills and being open to feedback, willing to learn, and looking at residency as just a one-year learning experience where you can gather as much knowledge as you can.
That's pretty awesome. So what does time management look like to you?
So a lot of times I think it's helpful to have a calendar of your own to where you can keep all different deadlines of what you have going on, and also as a way to keep track of other projects that are just outside of your regular rotation that you have.
Very nice, very nice. And then what would you say is an average day on your rotation? What does that look like?
You get here early in the morning and you start working up patients.
What does early mean? Let's be specific.
It starts at 7 a.m.
Okay.
And you start working up patients for the hospitalist that you're rounding with. And then in the afternoon, we go over the patients together and then meet up with the hospitalists either virtually or in person to make those recommendations and changes for the patients. Topic discussions in the afternoon and different projects along the way.
Awesome. And then how much autonomy does the resident get, like in the first few weeks? Because you're pretty early on in the residency.
Correct. So at first we do a lot of walking through how to use Cerner, how to use verification processes, med manager, things like that. So at the beginning of the rotation, there's a lot of guidance. We have different sit-ins, and then as you go, you get more and more independence and autonomy throughout the rotation. But because it's at the beginning of the residency, there's a lot of explaining along the way.
A lot of coaching, a lot of modeling.
Yes, taking notes.
Great. All right, anything else you want to tell the resident about you?
About me?
Yeah. That you're amazing.
That it's a lot of fun here at Boswell.
Awesome. All right. Thanks, Maylee.
Thanks.